So how many people with cancer does it take to change a light bulb? Well, only one, but it might take them a while to remember where they put the new light bulb. Cancer and cancer treatment is notoriously hard on the brain, often leaving people with even more frustration, loss, anxiety, and functional issues. Memory, concentration, word finding, brain fog, difficulties with attention are all fairly common symptoms. You may become fully aware that you can no longer do things you used to be able to do. Welcome to the Recovery Room Podcast, Episode 12, What Has Happened to My Brain? Today, we talk with cancer survivor specialist, nurse practitioner Michelle Kirschner. We talk about cancer-related cognitive impairment, what it is, why it is, and tips to make your life better if you are living with it. Whether you are podcast watching or listening, I appreciate you being here. I'm cancer physical therapist, Dr. Leslie Waldke. Please hang around until after the show to learn how you and I can engage in my wonderful cancer survivor membership group, Recovery Room Plus. This is the Recovery Room Podcast, discussing all things cancer and cancer recovery. We bring you the experts, accuracy, understanding, and next steps you need to be healthier, more confident, make better decisions, and live your best life after cancer. Welcome to the show, Michelle. Glad to have you back.
I'm happy to be back with you.
All right. So cancer survivors, cancer patients may just start quaking in their boots when we talk about remembering dates, remembering names, attention span, the ability to concentrate, processing speed, memory lapses. It is just, it's in the world of cancer right now, it's the kind of a misnomer as it's called chemo brain, right? But as you and I talk about, chemotherapy doesn't necessarily cause this. And people that have cancer that have never had chemotherapy have this problem. So the official title is Cancer Related Cognitive Impairment, CRCI. Because again, we're going to talk about it, but can you just tell us how common is cancer related cognitive impairment?
Well, it's actually really common during treatment. So about 75% of individuals will have impairment during treatment. So, that's fairly common. But the thing that really we should understand is that not everyone develops cognitive problems that continue after treatment. So about 35% have symptoms that persist. And it's interesting, we don't know why those particular individuals have that, but that happens.
So about 75% of people have it during treatment. And then for people beyond treatment, 35% of them, it just kind of keeps going. And it can be, I know it can be a couple years before it resolves. Okay, so let's just start. It's common. So both cancer and cancer treatment can cause cognitive impairment, right? And is that accurate?
Yeah,
okay.
Totally. So we know.
So tell us more about that.
Yeah, so with cancer, we believe that really it causes an inflammatory type of process. And what is released is something called cytokines. And cytokines, if you think about when you've had the flu and you've felt like you couldn't do anything, you were so tired and you couldn't really concentrate. Well, those are really that's caused by cytokines. And so really that same thing is happening on a smaller level. And so we're feeling those impacts of the cytokines, but then you have treatment on top of it and all the things that come along with it. And then that can worsen the symptoms.
Yeah. So again, both cancer and cancer treatment can cause this problem. So fatigue's not going to cause it. Sleep disturbance isn't going to cause it. Hypothyroid's not going to cause it. Being sedentary is not going to cause it. But those things will grossly negatively impact. If somebody's already got this, having something wrong with your thyroid, if your heart's not pumping well, if you're not sleeping well, boy, it's gonna turn a problem into a huge problem.
Right. So it magnifies. You take something small, and then it's an avalanche that's suddenly out of control.
Yeah. I think we've used the term, it's a mudslide.
Yeah, that's even better.
It's like, look out, man, here it comes. Because it all just kind of barrel roll and just create more and more of a problem. So, because life is already stressful, but when you forget to a piece of paper that has to be at your son's school, or you forget something silly like a telephone call with somebody, or you forgot to stop at the pharmacy, it just creates this massive problem of stress and sleep disturbance and more fatigue, and then you sit down more, and just it all helps kind of that negative feedback loop. Can you just kind of define what it is better for us?
Yeah. Well, I think, it's really important to understand that memory and cognitive function, there's different networks and they function differently. And sometimes, people will have these symptoms and they'll think like, I'm actually getting dementia. And so they're really worried and it probably worsens their symptoms. So it's important to know that there's these different networks, and there's two that I'm going to concentrate on. One is what we call the default network. And that network is really the idea of making sense of yourself. It has to do with your senses, but it also has to do with building up records over time. And that is really the network that's involved with dementia, like Alzheimer's.
So we're talking about networks in the brain, right?
Yes, in the brain.
Okay.
And they're kind of how they function. So there's that kind of memory network, but then there's another network that's called the executive network. And that's the network that helps us get things done every day. So it has to do with attention, being able to actually focus on something, to put it into our short-term memory, to use it, and to process things, to what we call set shift, which is what a lot of people call multitasking. And so all of those things are the things that are really impacted in CRCI. And the only other thing I'm going to say that's really interesting is that when you do testing, you can see the differences. You can see that these are the things that are impacted. And so sometimes testing can be really helpful if you're having severe symptoms and understanding where is your impairment coming from.
Yeah. So let's talk about testing really quick, because I know that, again, just like cancer in life, there's a severity, ruler of how bad it is. You can have mild, CRCI, you can have really bad, impairment from disease or from treatment. So if somebody really is struggling, who do they go to for a test?
So most healthcare systems have what's called neuropsychologists, and they really are the experts in doing this testing, and they do it for so many other health-related conditions. So they're excellent at it. And the other thing they're really helpful is they often will help with work-related issues. So when the testing is done, they really understand how those impairments, it could impact your work.
Right. Yeah. Because sometimes people may have, cognitive impairment during treatment, but because their life is just kind of going to appointments and doing what you're told, and the next is you may not notice it. But when you have to go back to life and do your banking and your grocery shopping and your cooking and getting to work and managing the kids again, and all of a sudden you're like, oh my God, nothing's working, that you may notice some symptoms for the first time in survivorship, even though it may have been there for a while.
I actually find almost all my patients first notice their cognitive symptoms when they're in survivorship. And the problem is if they're not connected with their team, then they don't really get help for it. And so they're struggling. And most people don't really know that you can improve. So people just kind of assume that this is something they're going to have to live with, but there's actually things that we can do to decrease your cognitive symptoms.
Okay. So let's talk about symptoms first of all. What may people notice? And then we'll talk about what we can do about them.
Yeah. So I think, one is like memory lapses. And I'll say a lot of people will say, I forget things, but that's not really what happened, because attention is the issue. It's really the thing never got into your brain. So it's not even there to retrieve. Other things that you can notice is like difficulty concentrating, difficulty remembering details like names, dates, or phone numbers. Very common. Oftentimes difficulty with multitasking. And so what you used to be able to do at work, where you would have the music on and you had people all around you, suddenly after treatment, you realize like, oh, this is not working. And so that's really important to understand that you might need to change your environment to be more successful. Things, just processing speed. So you might actually need to stop and think about something. It might take a little longer to kind of understand something you're reading, and also difficulty with word retrieval.
Yes. Yeah. So just like after an injury, it may take you longer to get dressed. It may take you longer to get up the stairs. And it's harder to do those kinds of things. Same things if your brain gets injured somehow or it gets irritated somehow. So it's the same kind of thing. But people that have this do not need to be worried about, oh my God, I'm going to get Alzheimer's or I'm going to get dementia.
No, this doesn't cause that. But I would say if somebody has a family history of dementia, and oftentimes they might not have any symptoms. sometimes cancer and its treatment could move you along that trajectory of symptom kind of exposure. So, if you have a really strong family history of dementia and you have a lot of cognitive impairment, I would recommend getting testing just to make sure there's not something else going on.
Yeah. Okay. Yeah. That's really, again, talk with your physician, make sure that there's not something medically that's happening that could be leading to these issues. So you always need to start with your physician, get a medical workup. And if those are all okay, then head over to the neuropsychologist. And I know a lot of occupational therapists do a lot of work with cognitive stuff.
Yes.
And again, even if they can't, there's some things we can do. We'll talk about what you can do. But the two bullets are, okay, what can we actually do to fix the physical brain? And then what can we do for symptom management? How if I don't have good attention, if I don't have good recall, if I can't do word retrieval, what can I do to help get through my day? Because I'm already stressed. And if I forget things and I can't remember, and what can I do? So give us some tips for people that are living with cognitive impairment to make their life a little less stressful, little easier.
So I would say, first of all, one of the things that's really important is just communicating with your friends and family about your symptoms and things that they can do to help you be successful. And like we talked about, sometimes it involves setting up your environment, maybe letting them know that it's going to take a little bit longer for you to understand something or process things, so they should just be patient. And one of the worst things is for people to point out your symptoms. Like if you forget a word or something, and then people are like, just like, hey, you forgot that word. And, you just need to teach them that's
Don't
not
do that.
gonna, because, next time it's not going to make you remember a word.
Right.
And actually, what we do know from research is it ramps up your anxiety, and then that worsens your symptoms. So I think that's really helpful. And then I think working on the things that are that we discussed earlier, like sleep, decreasing depression, anxiety, distress. So, sometimes if you have a family member that tries to put all their anxiety on you, sometimes it's just saying like, you know what, I can't handle that. And I dealing with pain and other things like that. So you really want to optimize the things that you can.
Yeah. So again, because many cancer survivors will say, I look normal, people expect me to be normal, but I am not normal, right? So again, if you don't take the step, whether it's the person that you live with, whether it's your boss or some of your colleagues or your children or your parents, just say, listen, I know I look normal, but I have cancer-related cognitive impairment. It's expected to go away, but it could be months or years. And the way you can help me is A, B, C, D. These are the things you can do to help me. And these are the things that are not helpful. But just that awareness and communication is definitely the first step. Because people will be, if they can understand it better, most people are going to be very, very helpful to you.
Right. And it's interesting. I would say that even a lot of oncology providers don't know a lot about CRCI.
Yeah, they don't. Yep.
It's not trained. So, I think that these things are really helpful that we're mentioning, because in the cognitive clinic that I have worked in, I have found that by telling your family members, it has actually improved symptoms a lot. And so it seems like a simple thing, but it really is helpful.
Yeah. Because I've been in oncology for almost 30 years. And when I first started, people were complaining about this stuff all the time, but it was never acknowledged, or there was no actual evidentiary proof that it existed. And then I think it was in the early 2000s, mid 2000s, that they started coming up with actual evidence. Like they can see changes, they can actually document changes. That was proven like, wow, this is an actual proven thing. And again, research takes time, treatment takes time, education takes time. So again, a lot of practitioners don't know a lot about, or they may hear it all the time, but they may not be the best person to ask. So again, question B, how familiar are you with it? If I know I'm struggling, and if it's not your area of expertise, who can you send me to? Again, a great question to ask. And again, social workers, occupational therapists, are great at, so not just learning about it, hearing about what can I do about it? Where do I go if I feel like I need to be tested, or who can help me with symptom management? Because again, this is the best world we've ever had to help people. There's so many resources, whether it's just picking up, your iPhone and asking for reminders, scheduling things. So learn how to use voice command on your phone. I don't want it's going to listen to me now, but, just say, hey, phone, because I don't want to say it because I'll send all of your phones into management mode. But you can say, hey, remind me at 4:00 to pick up my pills on the way home from work. And your phone will do that for you. Or remind me to call Joe. Or remind me tomorrow at 3 p.m. that I have to blah, blah, blank, blank, blank. So use your phone, use the technology that we have to help symptom management, because you're going to be again, stress can make it worse. Having less stress is certainly going to make it better. So if you don't have to remember anything, write everything down, put everything in your phone. That's just 10 things you don't have to remember. So it allows your brain just to go, oh, thank you. And it can do its daily functions better.
And I think OTs are really good at that. So, and sometimes it's the simplest thing that makes a big difference. I remember one OT told one of my patients who could not, remember where they put their keys. Always put your keys down in the same place. And then they came and the patient said oh, that solved the problem immediately. So yeah, simple things can make a big difference.
Yep. I have a place in this house for my keys. I have a place in this house for my wallet. And then, so that's exactly where they go. And again, it just reduces the trauma and it makes things easier. I also highly recommend that, and again, this is during treatment, after treatment. Again, stress and anxiety don't cause cognitive impairment, but they can certainly worsen it. So if you are living with a significant and you are having anxiety, you are having depression, you are having sleep disturbance, because a lot of people do, it's just because that's the way it is doesn't necessarily mean that's the way it has to be. It is okay to talk to your physician about medicating your sleep temporarily. Okay. This isn't something you're going to do for 6 months, but if you need help just to get through a week or two, kind of get you back on a sleeping pattern, that's fine to take medications. If you're anxious, talk to your physician about anxiety medication. That is absolutely fine. If you are in pain, again, talk to your physician about possible pain medication, or getting into physical therapy to make so why are you having pain? And let's fix what we can, because that all is going to contribute to making cognitive impairment less complicated. If it's something that you're going to have to live with it for a couple of years, what can we do to make that less miserable on that journey to full recovery? So the moral of the story is, if you feel like you have symptoms, maybe just take a journal or just be a little bit more aware of them for a couple of days. Go to one of your, whether it's your primary care physician, your medical oncologist, to say, I think I'm having these issues. Do I have them do a medical workup on you if it's necessary? And then if you feel like testing is warranted, they can help you find a neuropsychologist in your area. And then if you have symptoms, or even if your symptoms don't show up on the test, is okay, I have symptoms, whether I pass the flunk or pass the test, where do I go next for help? Again, whether it's the neuropsychology team, whether it's occupational therapy, whether it's a sleep specialist, whether it's medications. But don't just assume. I think people sometimes I'm a cancer survivor, I'm supposed to be miserable. That's hogwash. There's some misery that we can't take away. There's some fears that we can't completely eliminate, but there's a lot of stuff that we can minimize or eliminate or prevent, but only if we know that it's happening to you. So again, critically important for communication with your cancer nurse navigator, with your nurse practitioner, your physician, whoever you can get your direct line to. Again, we can't fix what we don't know.
I totally agree. And I just wanted to mention also, this concept of brain health is really important for survivors. And that, we just want everybody to kind of do things that can promote the health of your brain. And so that looks at nutrition. We have something called the MIND diet, MIND diet. So that's really kind of recommended for cognitive health. And then exercise, which solves everything. Being with people, socializing, mindfulness, meditation. And meditation is kind of, I call it weightlifting for the brain.
Yes.
And then, and things that we call awe. So like being involved with activities that really open our brain up. Yes. And so things like the arts, music, nature are great ways to support your brain health.
Yeah, things that move you, that make you feel wonder. Yeah, those are really, really powerful. And I want to wrap up with this, because you talk about brain, we talk about heart health, we talk about musculoskeletal health, and the brain is an organ. It's, the heart is different than the lungs are different than the liver, but the brain is an organ. And we have to treat it like it's something that can be impaired. We can get liver impairment, we can get lung impairment, we can get heart impairment, and we fix it, right? We fix that stuff. So we also have to focus on the brain as an organ. It can function fabulously, or it can have trouble functioning for different reasons. So you need to find out what it is and then work to fix it. It's not any more shameful than having a lung disease or heart disease. It is something that we can absolutely fix, because the brains are literally the seat of our health. They drive our health. They drive who we are and our emotion and our general function. You can't live without a brain. So it's really important for all of us to take really, really good care of them. And again, a nutritionist, a physical therapist for exercise. And so please use the resources that you have to your ability to maximize your health in your future, because you've just been through something horrific, whether it's just the diagnosis itself, maybe it was just surgery and or radiation and chemotherapy, but you go through that stuff to save your life. So let's make gosh darn well sure that it's a dang good life, right? Let's maximize what you got. So talk to your people and suck up as many resources as you can get your hands on, whether they're digital, web, or right in your own community. But let's do it. Let's do it. You deserve it, right? You deserve to be healthy. I think that sometimes, whether you're male or female, sometimes that's kind of like, well, people, you don't self-talk yourself down. You deserve to have the best possible life. Absolutely.
Well, Leslie, I really enjoyed our conversation today.
And this was great. Thank you so much for your expertise, and I appreciate talking to you. So any last words of wisdom for us before we sign off? I
would just say that to be optimistic. I think a lot of people who are having these symptoms really worry a lot. And I am hoping that this time that we spent together, that's really empowered you to be positive and know that there's resources and a really bright future out there.
Yeah. Fabulous. Well, thank you very much, Michelle. And thank you, everyone, for joining us on the Recovery Room podcast. Exercise well, eat well, treat yourself well, and we will talk again soon. Thank you.
Bye.
I love having you in my listener community. So if you haven't already, please follow and subscribe to the Recovery Room on YouTube and Facebook, and to the Recovery Room podcast. Please share these wonderful free resources with your support groups, family, friends, and medical teams. I also have an incredible cancer survivor community group called Recovery Room Plus. It's a subscription membership group I'd love you to consider joining. In Recovery Room Plus, you get direct interaction with me, in-depth cancer recovery info and experts, and really cool live events like yoga, book discussions, cooking demos, member meets, and much more. I would love to connect with you. You can learn more about Recovery Room Plus at recoveryroomplus.com. The link is in the show notes. In this episode 12 of the Recovery Room podcast, What Has Happened to My Brain?, we learned about chemo brain, or cancer fog, which is technically accurately named Cancer Related Cognitive Impairment. It's estimated that 75% of people during treatment have some type of cognitive impairment, and for 35% of the people, that can last long-term beyond the end of treatment. This cognitive impairment is not caused by chemo. It is not caused by poor sleep, fatigue, or cardiac function, but these things can directly make the symptoms worse and can pile onto the fact that you already have cancer-related cognitive impairment. So tip number 1, work on changing or adapting your environment so you can be more successful, using your iPhone or smartphone to schedule and remind you of things. Be more rigid in your daily tasks and routines, like where you put things and how you routinely do things. Tip number 2, let your friends and family know what you are dealing with so they know that even though you look normal, you may not yet be normal. And tip number 3, track your symptoms so you can specifically alert your physician, your nurse, your cancer nurse navigator to what you are dealing with. Talk with them about getting testing or getting a medical workup. If they don't seem to be following up with you, go to them and say, who can I follow up on these symptoms? Because of whether I'm testing normal or not, they are impacting my life. Please continue to advocate for yourself. You are the most important person on this planet, so remember to treat yourself like that. And exercise like your life depends on it. I'm Dr. Leslie Walke signing out from the Recovery Room podcast. Always a pleasure to have you here. Let's talk again soon.